All right, we're going to go ahead and get started. Good afternoon, good morning, everyone. I am Jean Wallace. I'm the Deputy Commissioner and Chief Engineer at the Minnesota Department of Transportation. And I'm also the Vice Chair of the Committee on Performance-Based Management with AASHTO. I would like to warmly welcome all the panelists and attendees to today's webinar. CPBM, or Committee on Performance-Based Management, is very pleased to produce this webinar series in cooperation with FHWA and the Performance Management Technical Support Program. It's a great way to bring people together around a series of important topics. And always a special thank you to FHWA, as their partnership is just really instrumental in making these webinars possible. Before we jump into the webinar, I just want to make you aware of another great opportunity to connect and network and collaborate with peer practitioners across the country. Please mark your calendars for the 2026 CPBM Annual Business Meeting, which will be held in San Diego, California, the first week of October. Stay tuned for more information on registration. It's going to be available on the TPM portal soon. So today marks the 30th webinar in our bi-monthly series featuring presentations exploring the criticality of safety performance and multidisciplinary avenues for integrating safety at state transportation agencies. For more information on this webinar series, please visit tpm-portal.com, navigate to Events in the main menu, and then select TPM Webinar Series. The TPM portal is also home to the series archive of recordings, downloadable slides, and other valuable resources related to transportation performance management. And if you have any suggestions on future webinar topics or have questions for the presenters during today's webinar, please submit your comments or questions using the Zoom chat. We will answer questions during the panelist discussion at the end of the webinar. Again, if you haven't already done so, please be sure to mute your audio so that our presenters are not interrupted. Thank you. So now I'm going to turn it over to LaToya Johnson with FHWA to present a few updates. LaToya.
Hello, thank you, Jean, and hello, and thanks everyone. Again, echoing Jean for joining us. I'm LaToya Johnson. I'm the team leader for the Transportation Asset Performance Team and Federal Highways Office of Infrastructure. And our team has responsibilities for implementing laws and regulations around asset management, i.e. asset management plan, and transportation performance management. So first, I just would like to express my gratitude for many of you for the work that you guys are doing to get your asset management plans recertified. I know that is top of mind for lots of folks on this call. And to thank you, many folks joined us on March 25th for the Federal Highway sponsored webinar where we were able to walk through the requirements and answer questions from state DOTs and other partners. And I thought it was a well-attended and very successful webinar. So we are looking forward to doing more of that. So like Jean, I want to ask you to mark your calendars for one more thing. On Tuesday, May 12th, we are planning our next webinar geared towards state DOTs and other partners working in asset management. But this one will be on the annual consistency determination. So I know folks are working on recertification and ACD at the same time. And so we wanted to create another opportunity to talk directly to us, for us to answer questions. So I'm not going to share the link to that registration today, but mark your calendars. In the next week or so, you'll be getting information from your division offices and others where we'll be promoting that. But I do want you to mark your calendars. On the TPM side, we are prepping and getting ready for our next reporting cycle that's later this year. But hopefully by the next time that we meet in our 31st TPM webinar, we will be able to share updated web pages with updated data from the state DOTs. We've been working to update that data and get it ready for prime time on our website. And so we're really looking forward to getting that out. A lot of folks have asked, Federal Highway, why do you still have 2022 data on your website? Well, we're trying to address that, and hopefully in the next webinar, we'll be able to share those updated web links. So Just a few updates from me on behalf of our team, and we'll put the email address in the chat. So if you have any other questions around the federal requirements around asset management and TPM, don't ever hesitate to shoot us an email, and we'll be sure to respond. Now, as we transition into the topic for today's webinar, I just wanted to say and reiterate Federal Highway and USDOT's commitment to safety, not just from the TPM perspective, where we all know there's safety measures that we report annually, but also from Federal Highways perspective and the entire department. And so for those of you who maybe were not aware, not Federal Highway, USDOT just published our 2026-2030 strategic plan. So we'll put the link in the chat. I implore you to go visit and read the strategic plan to hear more about our focus areas for the next 4 years. But a little bit of a teaser is that on page 6, the strategic goal that's highlighted is safety. And so it says that the department is committed to the safety of our transportation system. We will focus on proven interventions, modern technology, and strategic workforce commitments to reduce safety incidents and increase public confidence across all modes of transportation. So again, just excited to be here, excited about this topic. I've seen some of the presentations. I can't wait to hear from the states later in the webinar. But Federal Highway and USDOT, we're right here with you as related to safety and looking for best practices that we can also promote as a part of the work that we do for asset management and TPM. So with that, I just want to say thank you again. Don't hesitate to reach out if anybody has any questions for our team. And with that, enjoy the webinar, and I'm turning it over to Kelly Campbell. Kelly.
Thank you, Latoya. We really appreciate our federal highways partners. First slide, please. Next slide. I'm Kelly Campbell. I'm Research Analyst Principal at the Office of Highway Safety at Idaho Transportation Department, and I am one of the co-chairs of the Safety Data and Performance Management Subcommittee. And I just wanted to briefly talk about what our committee is about. Michael Vaughn, who will be presenting later on, is also is the other co-chair for this committee. So as you know, value is always realized when states can identify, analyze, prioritize, and evaluate performance, safety performance. But the key is using reliable data. And for us, it includes vehicle driver, vulnerable road user crash data, roadway and travel data, citation data, and I'm not going to read the rest. You can see them here on the screen. Next screen, please. And it's really important that we all are able to get that data, or at least have ideas on how we can utilize the data. And so it's really important that we have this subcommittee, because in this committee, we can actually collaborate with each other. I can steal ideas from Utah, Montana, which, trust me, I have stolen ideas from both of them. And it also allows us to collaborate so that we can effectively talk to our federal safety partners about the value of these performance measures, how our target setting is going, and the reporting, and how it is impacting the states, and what we can do to make these processes more efficiently. Next slide, please. A lot of the discussion topics that we have include planning level safety data needs, data collection, which includes your MUC and your MIRE. I know I have no idea who decided those terms, but MUC and MIRE, which are key to making sure data is consistent throughout the country so that we can actually compare, share, and utilize. Data analysis, including things like network screening, countermeasure selection, and economic appraisal. What are our state's different safety trends? Are the states around me experiencing a different change in their crashes? Are they going up while we're going down, or vice versa? Maybe we can tease that out a little bit more with the collaboration from other states. And of course, target setting and performance metrics, which is always a big topic when we get together, because we all want to make sure we are doing the best we can with our metrics so that we can use them to enhance our programs. And of course, one of the most important parts of this is working with your state's traffic record coordinating committees, because they have connections with all of the different partners uh, that have the data we utilize, and they can also provide funding to help agencies enhance their data collection. So next slide, please. And last but not least, I just wanted to mention yet another conference. This one's going to be the AASHTO Safety Summit. It will be happening September 28th through the 30th in Hartford, Connecticut, which I've never been to, so I'm pretty excited for this one. And just as a side note, if you're a part of the Committee on Safety, we'll be meeting on Sunday, September 27th in the afternoon for 2 hours, so we can actually spend some time together. The last couple of summits, we haven't had any time together, and we really would like to connect with each other. So if you're interested in being a part of this committee, you can contact myself, Michael Vaughn, or Kelly Hardy, and we can give you some more information. So thank you. I appreciate the time. And now I'll turn it over to Ryan Huff to go over the agenda.
Great. Thank you, Kelly, for all that information. I'm Ryan Huff, Secretary of the Committee on Performance-Based Management and also the Chief Strategy Officer at the Nebraska DOT. I wanted to cover a few of our learning objectives for today. During our webinar today, we hope to explore how states are implementing safety-related performance measures and management practices. We want to identify critical intersections within transportation safety and public health. We'd also like to highlight proactive strategies and advanced technologies that are working in tandem to enhance safety analysis. Lastly, as with any webinar, we're here to share lessons learned, ideas, and knowledge. With that, we'll get into just an overview of our agenda. You've seen the things on the left part of our screen here, but the remaining part of our agenda is dedicated to a series of discussions provided by several subject matter experts. I'll introduce our speakers before each presentations, but in brief, we're going to hear from Jeremy Thompson at the Ohio DOT, Lauren Blackburn with VHB presenting on behalf of the Virginia Department of Transportation, Mike Vaughn with the Kentucky Transportation Cabinet, and last but not least, Vanessa Spartan with the KDOT. One last reminder, our speakers will be going through their material. Please make sure your microphones are on mute and submit any questions you have to the chat. I think Jean said earlier we would cover those questions at the end. In addition to that, we hope to conduct a panelist discussion on just a number of things that come up throughout these different discussions. So I'll get into the first presentation. We'll now hear from our first presenter, Jeremy Thompson. Unfortunately, Jeremy couldn't join us today in person, but was gracious enough to provide a pre-recorded presentation for us. Jeremy is a safety engineer with the Ohio DOT's Highway Safety Program. He spent the last 8 years with ODOT, 6 of those being with the safety program. In his role, he oversees their systemic safety program, implementation of the Strategic Highway Safety Plan, and is a project manager for the development of an Ohio-specific context classification guide. And so with that, we'll get his recording pulled up and start that recording.
Hello all, my name is Jeremy Thompson. I'm a safety engineer in the Ohio DOT's Highway Safety Program. Sorry I can't be there with you today live. We're having our annual statewide safety meeting with our districts. So just so you can put a face to a name, here's me on a hike at Zion National Park a couple years ago. Well, lovely experience. So today I'm going to be presenting on a couple of ways that Ohio is trying to better understand the safety performance of some of our initiatives and projects, as well as one of the ways that we're working to integrate the safe system approach DOT-wide via enhanced project level decision making, primarily through the development of a context classification guide and the kind of subsequent policy decisions we make around that. So first, I'm going to discuss the use of telematics to better understand our approach and how we address distracted driving and how we're tracking the efficacy of our relatively new primary hands-free law. It's been around for about 2 years now. Before I talk about the use of the telematics data itself, though, I wanted to share our approach to messaging since the new law was put into place. On the left is our kind of bread and butter campaign that we've had since the law came about, where we take several settings, where it's okay to use your phone and take a here, not there approach. So in that graphic, you're free to use your phone at a basketball game, but never behind the wheel. I guess our tack to this is we're not trying to totally take away people's phone use, but there are places where it is unacceptable. And then on the right, middle and right side of your screen, we've also made available several toolkits to local governments and law enforcement agencies so they can do their own messaging, share things on their own social media platforms, and then have developed some other information packets and things like that that are available at the BMV and other places, large employers, things like that. Another tack that we've taken over the last couple of years is a paid and earned media strategy. So we can maintain a higher level of awareness that phones down is the way to go. In partnership with our traffic safety office, which is under the Department of Public Safety, we spend roughly $2 million a year on this paid and earned media strategy. So using both those HSIP and NHTSA dollars to make this happen. You can see the text is a little small, but this allows us to invest in a variety of different media platforms, from TV to radio to online streaming services like Twitch and YouTube, where we show these commercials. So in the middle of streams or on our professional or collegiate sports platforms on television. So now to the data itself that we're using to kind of track the efficacy of the law or the efficacy of any of these campaigns. So we're looking at how we can leverage primarily the cell phone data through telematics providers, and we've been working with Cambridge Mobile Telematics for this. So these charts from CMT show kind of different types of handheld phone use and screen interaction on the county level across the state. So that this more macro level of data at the county level has kind of been able to showcase general phone use, and particularly we're looking at phone tapping events and handheld call rates. So we're able to compare kind of county to county, see where we might want to target some of these campaigns or deploy law enforcement in higher numbers to target distracted driving. But we can also just kind of gamify this a little bit, show how we compare to the national average, show how counties compare, neighboring counties compare, things like that. So it's helpful more than one way. I'm going to play a short clip showing some of the more granular data that we're also looking at on this platform. So in this video, on the Street Vision platform that through Cambridge Mobile Telematics, we're zooming in to a specific county and then a specific city, and you can see the spikes of phone use along the network. And within this, we can sort by either tapping, which is more indicative of texting or using an app while in control of a vehicle, or time spent on a handheld call. So we can kind of sort between the two different types of distraction, and kind of look at a more granular level there. It's particularly useful when we're looking to refine any sort of media strategy. So if we want to get hyper local with it, this type of data has been useful, especially with enforcement. Enforcement has to be hyper local typically. So getting down to this granular data set has allowed our partners in various law enforcement agencies around the state to better target where they might want to do enforcement blitzes related to distracted driving. So that's just kind of a quick glance of how we're using telematics data to kind of track the efficacy of and better address track the efficacy of our distracted driving law and better address distracted driving through our behavioral campaigns, media campaigns, and enforcement around the state. Next, I'm going to pivot and talk about how we're tracking safety performance on projects. So every year we do project evaluation, so updated on an annual basis. We're actually updating kind of our next year's right now. Should be ready here shortly. I will note that these project evaluations I'm talking about, they're only done for projects that include safety dollars around the state. For us, that means our total highway safety improvement program formula allotment. But we also get a considerable amount of money out of the state budget, and some of those more flexible federal funds are added to our safety budget as well. So we get about 80% more than our formula allotment. So our formula amount is about $100 million a year, and we get about 185, give or take a few million in any given year for our budget. The projects that we're analyzing here, so I mentioned they're only those safety projects, but we're looking at projects that have at least 3 years of post-construction data as well. So this is kind of a lagging metric in the end. Our dashboard right now is looking at projects. The most recent year projects were constructed in on the dashboard is 2020, and we're adding those 2021 projects in now. And I will note that because this is lagging metrics, we are trying to adjust for inflation and volume changes that happen before and after the project and during the project life cycle when we're talking about things like benefit cost and crash rate reduction and things like that. So the first page on our dashboard that we've created that we can reference, or districts can reference, is focused solely on how well projects year by year and district by district have reduced crashes. So just a more holistic view of how we're reducing all crashes on the right, injury crashes in the middle, and severe crashes there on the left. This just kind of gives us those early general insights. It helps us know whether the projects that we are funding are actually effective. But also, if we take kind of that district by district view, it helps us know like what districts we might need to target for more effective projects if they haven't seen the crash reductions that other districts have. The next sheet that we have is dedicated to showcasing effectiveness by project categories or types. So in our project tracking system, there are a few different data elements that we can pull to assign a project a specific category or subcategory. I'm not going to show this, but we can kind of drill down those little plus buttons kind of to the left of each row and see the effectiveness of these different project categories or types by district as well. So maybe certain projects aren't working as well in certain regions of the state, or certain projects aren't working as well overall, and this can help us make better decisions moving forward and how we want to allocate the funding through our safety program. The last page that we have on this dashboard is focused on the benefit cost of our projects. I guess to gloat a bit, we've had a realized benefit cost of 2.21 on projects that were constructed 2016 through 2020, funded with safety dollars. So we're starting to use this data to determine how we can better and more effectively spend those dollars, bump up that benefit cost ratio. But I will note at the same time, some of these project categories or subcategories only have one or two projects represented within the data at this point. So moving forward with the understanding that data may be skewed, we can't use a single project to make program level decisions. So we'll wait for a few more projects under those categories or project types to be constructed before we're changing how we invest it in that specific project type. We do an additional project evaluation for roundabouts, arc cuts, and road diets. They're probably our three most popular and I guess at the same time most controversial types of projects that we're doing. And they're also the largest projects typically that we would fund through our safety program in like the $2 to $6 million range is what we're looking at, that depending on the individual project. So because of the popularity of these project types and the controversy that can come with them, we've added an additional layer to how we're tracking these. So beyond that dashboard that I showed, which does give us a general overview of these project types as well. We've drilled down these, looked to take it a more granular approach, and are looking at specific crash types as well, and how those are addressed through these 3 different project types. So as you can see, all of these have been successful in reducing crashes overall, particularly successful at reducing our injury and severe crashes. And then they've been successful in reducing those target crash types that we want with these. So those left turn and angle crashes there with R cuts, roundabouts, we also track those. I know it's not on the graphic on the screen, but road diets, we're seeing a slew of different crash types reduced, but typically, we're looking at speed-related or vulnerable road user crashes that we're trying to reduce with the implementation of a road diet, and those have been reduced in pretty good numbers. And the benefit cost of these 3 project types has been pretty good. I mean, road diets and ARC cuts specifically, as you can see in the graphic on the kind of bottom right side of the screen there. Roundabouts, benefit cost, not as great. They're expensive projects typically, but we do know that they kind of eliminate that potential for a severe angle crash. So we're still on board, and we know the life cycle of a roundabout is very long term. So next I'm going to talk about safe system integration through context classification. Now this is kind of a very specific way that we're integrating the safe system approach. So it's going to be kind of a more cursory look at how we're doing it. I won't get up here and say that we've done some sort of like full integration at this point, but here's one specific way that we are looking to better integrate the safe system approach across our DOT. So I know context classification and I guess incorporating land use into transportation decision making has been a hot topic in our profession for a while now. Just in case anyone's unfamiliar, I'll give a little background. So the idea is that land use is extremely important in the transportation world, and the decisions that we make, the policies we make, and things like that. Historically, a lot of our guidance, a lot of our resources have been focused on that urban and rural dichotomy, sometimes throwing in suburban in there for the trichotomy, and those perspectives. But our built environment and the guidance we provide can't just be defined by those. I think we've realized that that's not good enough. It's not far-reaching enough. So we are working in Ohio to develop a context classification guide where we're identifying the land uses that exist in the state, like you see on this kind of draft map that we've created here, and develop some guidance and some resources around how to proactively implement certain countermeasures or certain projects by land use. We'll also provide guidance on things like target speed, which is definitely aligned with the safe system approach. So in this guide, again, we're working to equip our practitioners and decision makers around the state with information on how to proactively address potential safety hazards within their projects by the land use that segment, corridor, network might be traveling through. Graphics like this one that I stole from the Maryland DOT will be used in our guide. It'll look pretty similar to portray the various elements that our project planners, decision makers on the project level should be including in their projects to kind of achieve or get closer towards having those safe roads or safe systems elements of the safe system fulfilled. And then even before project goes development, kind of the work that we're doing to develop this guide and kind of the data element that's happening in the background of the guide development here will be super useful to us to help just better understand our system overall. So with the draft map that I showed a couple of slides ago, we've done some analyses. Again, the map's just in draft form, so we haven't spent a ton of time yet doing any sort of analyses based off of it, but we've done a cursory look at like certain crash types by land use, or we've also looked at certain crash types by land use and functional class pairs. So we can use that to better understand, like expected user types, modal hierarchies, things like that, where we definitely need to take into account certain users and certain land uses. I mentioned we're developing a guide now. We're still fairly early in the development of the guide and its integration into our various processes, but we are very excited for the impact that we think it's going to make in our state, particularly in our approach to how we plan projects and how we execute those projects and make those project level decisions to make sure we're accommodating the users we need to accommodate in a safe, accessible, comfortable manner. That's all I got today. Appreciate your time again. Sorry I couldn't be there, but my email is there on the screen. Please reach out if you want to follow up and discuss any of the topics I shared today. Thanks again.
All right. Well, we appreciate Jeremy's presentation. It's very interesting what they're doing with context classification guides. I think some states are doing it already, but it's interesting to see how Ohio is implementing and hopefully how they can learn more from how that'll incorporate into what they're doing. We'll move now to our next speaker, Lauren Blackburn. Lauren is an AICP and is VHB's multimodal safety planning lead for VHB North Carolina. With over 20 years of experience in multimodal safety planning, Lauren's key areas of interest are in bicycle and pedestrian transportation, comprehensive planning, roadway safety, and community health. Prior to joining VHB, she worked for the North Carolina DOT as the director of the Division of Bicycle and Pedestrian Transportation. I believe she may have a presentation. There's the presentation. All right. I'll turn it over to you, Lauren.
Very good. All right. Well, good afternoon. Thank you for having me. I am, as was just mentioned, my name is Lauren Blackburn. I'm with VHB, which is a consulting firm primarily on the East Coast, but I'm here on behalf of the Virginia DOT. Stephen Reed would certainly be the best person to deliver this presentation, as he's been a great partner on this effort, but he's on international travel this week. So he recruited me to provide this update to you all. And at the end of this, I've got Stephen's contact information if you have some follow-up questions, if I'm not able to answer them. So I'm going to talk about what's called the PADS program or initiatives. It stands for the Prioritizing Active Transportation Health and Safety. And it's I think a really excellent example of how VDOT has been partnering with other disciplines, especially those in public health. Like I'm sure all of you, VDOT has been facing the growing and extended problem of fatalities and serious injuries on roadways involving pedestrians and bicyclists. This is a 10-year snapshot of their data as best they have it. And I know in 2024, there were some signs of hopeful decline. It does appear, based on preliminary information that VDOT has been tracking, that total fatality and serious injuries may have escalated again in 2025. But nevertheless, regardless of the ups and downs, it's been a continuously growing problem that they've been seeking to address. And they're not the only ones. Other disciplines and agencies and organizations across the Commonwealth of Virginia have been also thinking about ways that they can improve safety for all roadway users, which is really the story of the PADS approach. The mission of this group of interdisciplinary department heads and so forth is to enhance what they call multi-sector collaboration and develop active transportation environments for better walkable and active transportation safety, while also looking at it through a public health lens. This group of different departments, which involve the Department of Health, for VDOT, their recreation department, and a number of local governments as well, has really been relying on data as a key resource and asset, but also developing training and other resources for professionals and elected officials and others to be able to learn more about what they can do. So here's a history of the PADS approach. I won't go through each of these incremental steps, but back in the 2013, 14, 15 era, the Virginia Department of Health, like I'm sure every other state health department, had been going through various health assessments to understand some of the key problems that they wanted to tackle. And ultimately that led them to creating some strategic initiatives that led them to the Virginia Department of Health. Meanwhile, VDOT was also going through a number of other related initiatives. In 2018, they developed their first Pedestrian Safety Action Plan, or PSAP. The precursor to that was a pretty substantial pedestrian crash assessment, a deep dive in the data, which then fueled a number of preliminary or initial PSAP projects. And about the same time, VDOT and the Virginia Department of Health linked up with each other, started talking about what they've been doing independently. And the Virginia Department of Health invited VDOT to participate in what they called the Virginia Walkability Action Institute. And the Action Institute participants, which are a number of cohorts representing various local agencies across the state, became really interested in what they could do to improve pedestrian safety, and especially interested in what they could do to work with VDOT to fund pedestrian safety improvements. And so that essentially bored what we now call PADS, the Prioritizing Active Transportation Health and Safety Program. The today version of that is still some ongoing coordination between the departments. VDOT has continued to update their pedestrian bicycle safety action plan analyses. About every 2 years they do that. And then in 2023, like I'm sure many of you, they incorporated a lot of that work with the Virginia Department of Health into their vulnerable road user safety assessment. So one of the things that we learned in partnering with the Virginia Department of Health is that a lot of the issues underlying personal and community health is very interrelated, interconnected, and highly associated with environmental conditions, social conditions, physical conditions that populations may be experiencing, which have an over-representation in the health outcomes of especially lower income families and populations across the state. And so the more we learned more about what data existed, it led to some conversations about how can we incorporate social determinants of health into pedestrian safety improvements. And luckily for us, the Virginia Department of Health had been developing for a number of years what they call the Virginia Health Opportunity Index. This index is really a combination of about 14 different measures that you see in that orange box at the bottom of various demographic and population-related indicators. They're not a representation necessarily of specific numbers of individuals with particular health outcomes, but really, again, going back to that social determinants of health and what folks know to be really related to those health opportunities or health outcomes. And so this is what it looks like in a data format. So Virginia Department of Health has been publishing their Health Opportunity Index for a number of years. It's a indexed value, again, that composite of indices at the census tract basis. And so if a census tract is described as having a very low opportunity for health, then that effectively was an area that we wanted to study further for the relationships to pedestrian safety. Meanwhile, thinking about other data factors that could help better describe where the problems are most frequent and severe. Those pedestrian crash assessments I discussed earlier, they've been updating those every couple of years as well. And of course, statistics like you see here are really what help point the light towards the more significant highways. VDOT's system represents about 62% of where the fatalities and serious injuries of pedestrians were occurring. Most of those happening in urban and suburban contexts, and then a large share of those occurring in more arterial roadway types. As you can see here, in urban context, and this is what just really grabbed our attention, is that about 84% of the pedestrian fatalities were occurring on those urban arterials, and these, of course, largely being on the VDOT system. So the question there was, what can we do with this data about the roadway system, with what we had learned with the Department of Health about their information, to help better identify locations of interest in high-risk areas? So this data has been brought together in what VDOT calls the PBSAP, the Pedestrian Bicycle Safety Action Plan. And again, another aggregate of these risk factors was pulled together that is applied to the roadway network. About 50% of the risk factors are directly descriptive of roadway characteristics, ADT, roadway configuration, posted speed limit. About a quarter of the risk factor inputs are based on what we call built environment factors, whether or not, for example, there are bus stops proximate or parks. And then about 20% is attributable, we'll call the demographic or social indices. So that HOI, the Health Opportunity Index, is one of a couple different factors there. And then a 5% portion of the analysis is devoted to crash history. And so it looks like this. VDOT has updated the PBSAP. This is the 5th round of that. It's published every couple of years on a website just like this, where districts as well as localities and other VDOT office staff can review a roadway based on whether or not it is identified as a top tier segment. In most of the cases, the PBSAP represents it as either a top 1% of all roadway segments, both VDOT system and locality, or on that top 5%. And so one thing to note here is that the PBSAP analysis results, like what you see, are also an input into their project prioritization process that they call Smart Scale, as well as an input into describing some of the needs as they're scoping potential highway projects. So another outcome or use of the PBSAP has also been to inform pedestrian road safety assessments in partnership with the health department. And one of the things that we've learned in conversations with them is, whereas our conventional RSAs will typically involve public health professionals as maybe secondary participants. Of course, we have our traditional participants, roadway owners, planners, traffic engineers. But what we've also learned is that a road safety audit that really places an emphasis or priority on public health and community perspective also allows us to bring in what we might call community liaisons. So this could sometimes involve a neighborhood advocate or a neighborhood representative, but also even just the public health officials themselves working very closely in the communities can be excellent resources to help provide more context about what's happening on these roads that were identified as a strong need. And so we've invited these participants in a number of road safety assessments through the PATHS program to participate in the preparation meetings, as well as the field review and even reviewing the recommendations. And in some cases, these local partners are able to help work with the community and, for example, providing more education along these RSA corridors while VDOT or the local roadway owner is working on developing infrastructure improvements. So we've asked ourselves these questions as we've identified who we can involve in the RSA process. It really just comes down to who has different perspectives that we can help just provide more context. Again, the trained professionals walking the roadway, we see a lot of infrastructure needs that we can flag as an opportunity for physical improvement. But the community participants and public health officials can give us a lot more perspective on why people may be traveling where they are, what times of day they need to be accessing the road, and maybe even changing demographics. The PADS program has conducted, I would say, about 9 of these public health focused RSAs over the years. They've been publishing summaries of the RSA documentation as what they call short stories on the PADS website, which I'll show you in just a moment. And then also providing linkages to other VDOT information and resources about how the HSIP program works, for example, and other funding streams. So if you're interested in learning more about the Virginia PADS program, it's a pretty simple URL. It's virginiapads.org. There you can find those short stories I mentioned about the different RSAs that have been performed, as well as a lot of other resources collected over the years. And I'm sure Stephen misses not being able to join today, but if you have questions about some of the other components of the program, I'd certainly encourage you to reach out to Stephen. I'm happy to answer questions if you have any about PADS today. And then otherwise, definitely encourage you to visit the Virginia Strategic Highway Safety Plan website, which is where you can also learn more about the PVSAP and their vulnerable road user safety assessment. So thank you very much, and happy to answer any questions.
Thank you, Lauren. We have the chat pod that people can type their questions into, and we may wait to answer some questions. I'm sure some will come to people's minds as they chew on what you had to say. We really appreciate those perspectives. We're going to probably move on to our next speaker. We'll hear from Mike Vaughn. Mike is the Traffic Safety Branch Manager for the Kentucky Transportation Cabinet, or KYTC, within the Division of Traffic Operations. In his current role, Mike leads a team of engineers who administer Kentucky's Highway Safety Improvement Program. I'll turn it over to you, Mike.
Can everybody hear me okay?
We can.
And you're seeing my screen?
Yep.
All right, good deal. Today I'm going to talk to you guys about our Vision Zero Louisville initiative, and kind of more specifically, slide's not wanting to advance. There we go. Some of our vulnerable road user focused road safety assessments that we've been doing, which has kind of been the foundation for a $15 million progressive design build project that we're in the process of getting kicked off and underway. We've not yet selected a design build team, but we're close to completing that part of the design build process. So before I kind of jump into the RSAs and everything, I wanted to give you guys a little bit of an overview of some of our fatal and serious injury crash statistics. This is from a 5-year period of 2019 through 2023. And I mean, you can see at the statewide level, roadway departure is a big challenge area for our state, followed by intersections. VRU is not a huge percentage, about 10% statewide, but when we start looking at our Louisville or Jefferson County area of the state, those numbers kind of flip quite a bit. Intersections is kind of the leading contributor to our K&A crash challenges, and VRU is noticeably higher. You can kind of see that in the red box there. Now, if we only look at the fatalities, there's even more interesting numbers, if you will. You will notice that the VRU number for fatalities statewide is a little higher. We have been triggering the VRU special rule the last few years. being that we're hovering right around that 15% mark. But specifically for the city of Louisville and Jefferson County, which is the county city of Louisville is within, it's an even higher percentage. And so it's been a big challenge area for us, but we also view that as an area for significant opportunity as well. And so we began back in 2023 the RSAs that have a VRU focus in the city of Louisville in the Jefferson County. Um, the RSA team, we pulled together quite a bit of folks from all over the place. We specifically wanted a good, strong partnership from the city's DOT staff, as well as the Metro Police Department. We got some participation from EMS. I didn't have it on here, but we did get a couple of folks from public health. They weren't always able to stay engaged, but they were definitely interested and provided some good insight throughout the process. And of course, we had staff from the transportation cabinet out of our Office of Highway Safety, our local district office, which was there in Louisville, and then some of our central office staff. Now, while we called these VRU focused RSAs, our ultimate goal is to identify any safety improvement opportunity for any and all users. It's just we did kind of tackle this with a focus on those vulnerable road users. The first year that we began doing these was very early in 2023. The way we decided to go about site selection that year was to perform an RSA at all the locations that had recently experienced a fatality or serious injury. For the city of Louisville, depends on the year, but on average, we've been seeing somewhere between 90 and 100 fatalities and serious injuries. And so there was a lot of sites to do. We were going out every other week to do RSAs. We just kind of had a reoccurring appointment. Everybody just knew, hey, every other Wednesday or Thursday, I can't remember which day it was now, but everybody just knew, like, show up at this spot, we're going to go do RSAs. We had a consultant that helped us organize and lead those RSAs, but we hit it pretty hard. One of the critiques we kind of got early on, both from our internal staff and some of the city staff, was that our site selection seemed reactive. We were going out to where we had a recent fatality or serious injury VRU crash, and they weren't necessarily wrong. We were in the process in 2023 of creating a high injury network. And so when 2024 rolled around, we just completed that high injury network report in January of 24. And so in 2024, we kind of took a hybrid approach. We were still reviewing locations that had recently experienced a fatality or serious injury VRU crash, assuming that location had not already had an RSA. But then we were also strategically targeting the high injury network. Now, what I'll say is the high injury network is a high injury network for a reason. There's a lot of injury, a lot of fatalities on that portion of your network. So a lot of the sites we did in 2023 were on the high injury network. I mean, there were some that were not, but the majority of our RSAs from 23 were actually on the high injury network. And so in 2024, we were kind of starting to fill in some of those gaps along the high injury network, especially the higher priority portions of the high injury network. And then our third year, last year, we were primarily performing our RSAs on the remaining gaps of our high injury network. Some of the key findings that I want to share with you all was that a lot of sites that, especially in that first year, a lot of sites we went to were interchanges, the ramp terminals, the intersections of these interchanges, and a lot of those were in those lower income areas. It's no real surprise. There are just more people that live in those low income areas that they have very little options. They're biking and walking a pretty good amount of their travel, either the entire distance of travel, or at least to a bus stop. But more specifically, when we got to those sites, a lot of those severe crashes, we saw them occurring where we had a free flow ramp movement, especially when it's the free flow from the surface street onto the ramp. A lot of times those vehicles were going whatever speed limit along that surface street, be it 30, 35, 40, 45, and that geometry didn't really force them to slow down until they got to that yield point onto the ramp. And so there was just a lot of challenges there. It ended up leading to kind of a sidebar study where we looked at all of the interchanges on one of the beltways around Louisville. Louisville's kind of got a wheel spoke type arrangement with the arterials, and so that a lot of those interchanges along that beltway where those arterials would cross the beltway, that they were problematic, and they had a lot of high-speed ramps because there was so much traffic getting on and off. But when those interchanges were designed in the 80s, nobody really thought about how does a pedestrian navigate this, and so we've been studying that pretty hard ever since to look for opportunities to reconfigure those interchanges. Another interesting finding was when we had kind of our higher speed arterials, 4 or more through lanes, usually there was no median refuge, which also meant we probably didn't have a lot of access management. Sometimes there was a 2-way left turn lane, and other times it was just a 4-lane undivided. But those roadways really they make up a lot of the high-injury network. But even when we were kind of in that reactive phase of going out where we had recently had a fatal or serious injury VRU crash, these roads were very, very common for us to do the RSA on. So when as we collected all this data, we began putting it into what we called the master spreadsheet. So we were collecting not only the challenges that we were seeing in the field, but also the ideas for improvements. You can see here curb extensions, high visibility crosswalks, improving VRU facilities, lighting, roadway reconfiguration. A lot of you all know it as road diet, and then speed management countermeasures. Those tended to be the top recommendations. The screenshot you see off to the right, this is a map of the gaps in our sidewalk network. And so one of the spinoff projects that came out early from these RSAs was to begin evaluating all these gaps and trying to prioritize what's the best opportunity to improve VRU safety by filling in these gaps. It's going to be a several year process for that project, just because there is a lot of gap. But that is something that came out really early. As I mentioned, we created what we called a master spreadsheet to kind of compile all the data, all the problems we were seeing, all the recommendations we'd brainstormed into a master spreadsheet. We then took that master spreadsheet and have created a VRU RSA story map. So there's some advantages here. We get some digital integration of all this data on a GIS platform that is hosted on our internal servers at the cabinet. Our consultant worked with our GIS and IT team. They did all the heavy lifting, but those connections to kind of behind our firewall and stuff, they worked with the appropriate folks to get those connections made so that this data could be housed on our servers. And we're able to link that with all kinds of other data elements we already have, which really brings about the ease of use. We've got all these known locations of issues, we got all these ideas, and so being able to share that data, look at it, look at those recommended actions, find potential project ideas. We're seeing that this story map is really helping that process. Kind of more specifically, is a lot of that's through dynamic filtering, where we can take a situation that maybe we've brainstormed and start filtering out well, where are we seeing challenges? Where are appropriate countermeasures, and how does that layer with other pieces of data? Um, and then, we're looking for those targeted insights. This example here is where we're looking at pedestrian signals and other infrastructure layered on the hydrogen network. So the hydrogen network is kind of those purple lines there. And then the orange dots were some of those recommendations for pedestrian signals or upgrading the infrastructure for PEDs. But again, specifically along that hydrogen network. And so it's been a really good tool to help us decide where we want to invest some of our VRU funding and general safety funding for that matter. Now, with all that said, we are very data rich, and I would say we're still a little poor on implementation. We've done a lot, but there's a lot more to do. And sometime last year, we kind of just came to the realization that if we do this the typical way of design, bid, build, it's going to take way too long. We've got a saying in Kentucky that safety is urgent. And so we started exploring ideas of, well, how do we get all these recommendations, all these challenging areas that we've identified? How do we get solutions out to them quicker? Um, and the progressive design build idea is really what came out of that brainstorming. Um, we're going to devote $15 million of HSIP funding to this project. So it is kind of a small project for progressive design build. But so far in the process, we have received interest from 5 different design build teams. So we were a little worried about it being on the small side. 15 million is not what you typically think of for a design build, but we've gotten a lot of interest from the industry. We really like this idea because it's going to allow for a lot of flexibility working with that design build team to dig through the story map, dig through our hydrogen network data. Louisville recently completed a speed management plan. We've got a bunch of other Vision Zero Louisville safety reports and technical appendices and just all kinds of, like I said, data rich things. And so working with this design build team to figure out what's the best way to invest this money, what countermeasures and where, how do we get that best value? One of the big things that I'm excited about with the progressive design build is being able to more openly work with the contractor and our division of construction to figure out, okay, we know which countermeasures and which locations, but how do we go about bundling and building these things in phases so that we can get economy of scale, we can get efficient construction scheduling, and hopefully we can minimize the impact to traffic through the work zones uh, by being able to be more open and candid discussions with the contractor. Um, so, kind of wrapping up here, what makes the efforts that I'm talking about noteworthy? Well, in my opinion, it's partnership. Not only the partnerships that we've had through our VRU focused RSAs. I mean, we've had a pretty massive multidisciplinary team. We've been working together for years now, looking at data, looking at sites, getting a better understanding of our challenges and our opportunities, but also the partnership that we're going to have with this progressive design build project. We're going to have a lot of those same folks that were part of our RSA efforts, the planners, the designers, the traffic operations folks, our maintenance staff, working with our in-house construction and the contractor team. And, the contractor team's going to have a variety of subcontractors, a designer, and maybe even multiple consultants for that matter. But it's going to be a pretty big group, but it's exciting to think about that partnership that we're going to have with all these different stakeholders to determine the what, where, and how of the best value in implementing $15 million in safety investment. We're really excited at this opportunity and the partnerships that it brings. I can go ahead and tell you that the work we've been doing with these RSAs it has really improved the partnership between the Louisville DOT and the Kentucky Transportation Cabinet. Not that we had a bad partnership in the past. We've had a good partnership, all along, but it is extremely better partnership now, much stronger partnership. And so much so that, and a lot of states have done this where they've tweaked the safe system approach graphic, but we came to the realization that in order to truly implement the safe system approach, we've got to have partnership at the center, holding the 5 elements together, figuring out ways to work together. And if you can't build those partnerships, you're going to just be right back into silos that are just named something different. Those silos will be safe people, safe vehicles, safe speed, safe roads, and post-crash care. But if you can truly build partnerships, that's how you truly get that system working together and implementing those principles on the outside of the wheel. So again, for us, it's been great to look back and see how this effort has really strengthened that partnership with the local stakeholders in the city of Louisville. With that, that's the end of mine. I don't know if you guys want to do any questions now or hold those for later, but if you have questions later, you can email me at my email there, or you can always reach out to our team email address as well.
Well, I appreciate that, Mike. I definitely will have questions later during the panel discussion. Appreciate what you guys are doing and the insights that you brought to the table today. We're going to move on to our last and final speaker for today, Vanessa Spartan. Vanessa is the Chief of Transportation Safety at the Kansas Department of Transportation, which strives to reduce traffic deaths, injuries, and crashes on all public roads in Kansas. Vanessa oversees the Kansas Drive to Zero initiative, which engages hundreds of stakeholders with a shared responsibility for traffic safety in Kansas. In her tenure at KDOT, the state has experienced a 5-year downward trend in fatalities, including a record in 2024 for the lowest fatality count in the history of Kansas, with records dating back to 1947. So very interested to hear what secret sauce Vanessa has to share with us today. I'll turn it over to you, Vanessa.
Certainly. Are you able to see my slides?
We are.
Okay. It's always kind of funny trying to share it and making sure you get the right screen. So thanks for the introduction, Ryan. What I like to call the Drive to Zero is kind of just this larger initiative that covers everything from marketing and branding to the Strategic Highway Safety Plan. That's part of the NHTSA program. I mean, we just kind of try and put everything under that one brand largely, but also it as a performance management area. So that's kind of the overarching thoughts around that. I'm going to quickly go over Kansas's organizational structure because every state's a little different, which I think will maybe help with understanding if you hear something, how you might want to bring it back to your state and where you might have to go, right, within your state to accomplish some of those things. And then I'll get into kind of high level our Drive to Zero, what engagement and partnership looks like as my colleagues were just talking about, Michael was just talking about, some tools that we've built, and then kind of some more specific areas that we're doing in an area that I call safety co-benefits, and then some of the stuff on post-crash care. What's kind of nice about going last too is that, I already know what all my other partners have been talking about, and we do such similar work. But what I just want to help you guys understand is in the Bureau of Transportation Safety, we sit within the Division of Planning. We oversee the Highway Safety Improvement Program and the Strategic Highway Safety Plan, all of the NHTSA program areas, including that traffic records coordination we heard Kelly talk about earlier. We manage state safety set-asides. We are the agency of record for all of the crash reports and crash data, including not only that records retention, but the analysis, the open records requests, all that stuff. And then we also serve as the subject matter expert for the agency and for the secretary when it comes to transportation safety. So that includes legislative testimony, fiscal notes, overall performance management, not agency-wide performance management, but safety performance management. NTSB, surface transportation responses, and discretionary grants kind of that fall within transportation safety. So lots of little things that add up to a whole lot of work, but I'll talk a little bit about some of the other bureaus that are within the division later on and some of the work that we're doing with them. And then I want to talk a little bit more, my presentation will more focus on within the agency, some of the things that we're working on. So in 2023, we took FHWA up on their offer to do an organizational safety culture assessment. And that was hosted by FHWA and a consultant subject matter experts that came in, and we did multi-day workshop activities that focused on really a two-prong approach. One was programmatic integration of safety across the agency, and then the other one was our internal culture. And then this kind of abbreviates some of the outcomes. There's so much work in this space, but under our Deputy Secretary at State Transportation Engineer, we established the Safe T Team, which is internal group of individuals that are bureau chiefs and division directors that are each trying to move initiatives forward. And then it also informed our strategic highway safety plan, or our Drive to Zero plan, in several different areas and aspects. So all right, so as I mentioned, transportation safety, we're this red box down here. When I talk about programmatic integration of safety, most of it sits under our STE and the different divisions and bureaus that we are working with in that space. But then there's also the Division of Aviation that has been involved in some of this work. And then we have a Division of Safety, which really deals with employee safety. We've been working with them on the safety culture work, as well as our public relations and public information bureaus. And then in these light blue areas, we obviously, because part of legal and risk management is all the safety management stuff as well. So we work with our chief counsel office a lot. We work with our Division of Policy and Legislative Affairs a lot. Because we do traffic records coordinating, we work with IT a lot. We work with our Office of Performance Management and Continuous Improvement. And then I highlighted finance and budget more specifically because in our state, we have performance-based budgeting, and safety shows up not only in our agency and across a lot of different parts of the budget of our agency, but also in other agencies of the state. So a lot of times we have to provide data for these other agencies to be able to do their budgeting efforts as well. So I'll talk about not everything, some examples that I think maybe might be most valuable or most interesting to this group. Beyond our DOT, we also regularly work with these state agencies, and we have other state agencies we work with, but these ones are pretty consistent. So in Kansas, our Highway Patrol is the agency that's responsible for FMCSA, federal safety requirements. So most of the safety stuff sits with my bureau, aside from FMCSA. We also work with our Highway Patrol in a lot of other areas. We've been working with our Board of EMS and Board of 911, not only in traffic records activities, but also in post-crash care activities. Our Department of Revenue in Kansas is our driver and vehicle licensing area, so we work with them in a lot of different areas. We work with our Bureau of Investigation, our Attorney General's office, our Department of Health and Environment, primarily in either public health and injury prevention work, like Safe Kids Coalition and active transportation and things like that, or in kind of the trauma care side, right, in the post-crash care side. So kind of two different angles at their agency. We work with our Turnpike Authority, and then I mentioned here the Kansas Infrastructure Hub. They're not a cabinet agency, but they were established after IIJA, and basically they're available to provide resources and technical expertise for entities to pursue discretionary grants. So we've been working with them a lot on SS4A and some other stuff. So that gives you an idea. We have an executive coalition that oversees our Drive to Zero plan implementation. There's 30 executives that serve on this coalition, and these logos represent them. So again, representing federal and state and local agencies, non-governmental organizations, private sector, and we have our Kansas House and Senate Transportation Committee chairs represented on there as well. And really what they do is they help with, providing big vision decision making. Anytime that we are really dealing with something that is a technical limitation or a capacity challenge or a resource need, we bring that to light, and maybe it means that we have to pivot, or maybe there's another angle that these different executives can help bring to those initiatives. So below that executive body, we have strategy teams and support teams that follow the safe system approach, if you know what those are. But basically, these people provide, they're volunteer members largely, but there's around 300 of them across these different teams that help us to advance initiatives. And so there's a lot of people from within the DOT, but there's people from all those different agencies I mentioned on the other slide, as well as others. So there's a lot of outside involvement in helping to move momentum. Okay, the one thing that I think really gets at maybe one of his comments there at the end, which is that you really need your partners to help with this initiative because it's too big for any one person, any one bureau, any one agency to tackle. So, I like to say, like, if you think that you can just assign your state highway safety engineer to go to every meeting and help make a decision for everybody, that's not going to work. You're never going to be able to scale. So we've been really focusing on establishing different types of tools for different types of decision making. The first one was our Drive to Zero dashboard, focusing on fatal and serious injury crashes. We established a dashboard for our safety corridor program that we established. Following our vulnerable road user assessment, we established a tool for anyone to use to identify high risk and high injury corridors and priority areas. I'll talk about that one a little bit more. We recently, last year or so, we did an analysis on the timeliness of post-crash care and developed a tool for that as well. We have our annual crash facts book that we publish. That's mostly used for media purposes and communications purposes. We have a couple internal use tools. So we took all of our crash data and then for like each of our district established a series of dashboards for them where they can easily see not only like 10 years of data, all severity level, but like trends and patterns across them basically. And then we've been doing safety performance analysis and network screening for a number of years. We're actually in the process of switching vendors this next year. And this new vendor that we're going with is going to allow a lot more integration across different groups where like we all are using kind of the same tool, the same analysis methods, and will really help streamline analyses processes, decision-making across a lot of different groups that are helping us. I won't be able to get into our Drive to Zero plan, but you can learn more at our website, ksdot.gov/drive to zero. We have 23 strategic initiatives for the next 5 years that were identified as the priority efforts. I'm going to highlight the ones that have arrows next to them today. So a safety co-benefits area, some stuff on safer vehicles I'm going to barely touch on, and then some stuff on post-crash care I'll barely touch on. So this is a snippet of one of our action plans. This is the action plan for this safety co-benefit strategy. We do update action plans every year. We'll be doing that later this month. And I don't anticipate you can read the whole thing, but zooming in on a couple of the steps we'll talk about. So 1.2 is about our programs within our agency and how do we improve safety benefit within those programs. 1.4 is how do we provide examples for local agencies to do similar work. And then 1.5 is more specifically targeting MPOs and the work that they do and how they can help lead their region in these efforts. So a little bit out of order, but an example of one of the things we are doing in the co-benefit space with local agencies is we're working with our LTAP Center to develop a series of webinars. This one we just held in February that is really about integrating the safe system approach in a bunch of planning and policy and budgeting efforts that local governments can do. And this comes from an NCHRP project that was led by one of our consultants. And basically, we're taking the results out of that process and creating a series of webinars about, how you can focus on safety within agency policies, within standards, within budgeting and decision making, all these different things. So this first webinar was really just scratching the surface, and we actually conducted a survey during the workshop or during the webinar to understand what they would find most beneficial to hear more about, with the idea that we'll be able to do more series of this work. This helps with one of our kind of overarching statements within the Drive to Zero plan, which is that one of the big goals is actually localizing the strategic highway safety plan, right? That it shouldn't just be a state plan, that really, 60% of our severe crashes are on the local system. We need the local agencies doing their part as well. On the MPO side, next week we are hosting a safe system integration workshop for our MPO staff, and they're able to invite some guests as well. Basically, they did a pre-workshop self-assessment. In that workshop, we will be our consultant will be leading the effort, but going through that self-assessment process, using examples from across the country of how other MPOs do things, but also a little bit of peer-to-peer learning and then really thinking about kind of the next actions and steps that they want to take back to their MPOs. And then us as an agency thinking about like, how do we best support those goals that those MPOs would have. All right, so getting into the safety co-benefit one, I have a series of slides here that I kind of broke out by division to help go back to that org chart of all these areas that we're working with. So overall, there were 6 divisions and bureaus that we identified that had program areas that we could generate additional safety benefit within those program areas. So this is like looking beyond HSIP into other areas of like dollars and program and prioritization that we do in our agency, and how could we get either create safety benefit where it doesn't exist or to make it better, to improve upon it. So out of these initial kind of discussions we've been having, we've been identifying some areas for improvement, and I'll go through those on a couple slides here. But some of the things that we saw that were kind of cross-cutting all these different bureaus and divisions was a need to better integrate crash, risk, and asset condition data across these programs, right? To help them quickly integrate that type of information so then they can make decisions that fit their program goals. Expanding network screening or performance analysis work. More specifically, there was a couple different program areas where, you know, if we could pivot the data to focus on vulnerable road users, or if we could pivot the data to focus on nighttime conditions, that was going to be kind of within these different program areas where it would be most beneficial for them. Updating some standards to help with consistently using proven safety countermeasures. There's some things that are out there that we don't really, either we don't have standards on or they're outdated. So going through a process of some of those that we know that are proven safety countermeasures and getting modernized standards. Improving coordination between our preservation teams, traffic engineering, and local operate in different parts of projects, but not always together at the onset of the project. Develop a clear safety definition for local programs, because how we define it for locals will depend on how they apply for the program, right? I like to use the analogy of teach them how to fish. So if you tell them kind of the criteria that you're hoping to see, what we mean by that, you'll start seeing better and better. Creating guidance and maybe a list of eligible countermeasures that would allow people to more easily identify those potential improvements. And then documenting our current practices that kind of touch in the safety space, and then also communicating the progress along the way of where we're making improvements. Okay, so quickly, in the Division of Program Project Management, we worked with them actually to identify what we thought were the candidate corridors for increased benefit. And then within that division, the Bureau of Economic Development, we sat down with a state-funded program called the Cost Share Program, which is targeting local agencies. We identified 3 real areas of improvement, which was enhancing the project scoring criteria, providing clearer definition and guidance on safety benefits. And then more specifically, they get so many applications, like I think 70, they solicit twice a year. They get on average around 70 each solicitation, but they're only able to fund around a dozen. So kind of going through that application list and quickly saying, okay, these ones would be safety funding eligible, right? Like we could fund them with federal dollars if the local agencies are willing to federalize the project. So kind of basically offering more money to get stronger applications. Division of Project Delivery and the Bureau of Construction Materials, kind of 2 different program areas. One is the 1R program. Every DOT has a 1R program. But we also have a state-funded program called Preservation Plus. And the goals of Preservation Plus is to add safety treatments in the pavement preservation activities. We have done this with rumble strips, but we haven't really gone beyond that yet. And so what we're really talking about now is utilizing network screening and other solutions in actively identify safety needs or areas of concern, I should say. Looking at other quick systemic treatments, because the pavement program goes so fast. So looking at friction cores, I already mentioned rumble strips, but different types of treatments of rumble strips that would allow them to apply in more places. shoulder treatments, and different types of pavement markings as well. They have a real desire for just as quick as possible. So we called it kind of a plug and play worksheet of, check this, check this, check this. Here's some eligibilities. So we will be working through them on that process. In the Division of Engineering and Design, we've been working with two bureaus. In traffic engineering, we've got the pavement marking program, lighting program, and signing program. And basically, the biggest overarching theme here is kind of helping to use data to identify better projects, locations, and then also like kind of for scoring, which ones should be higher priority versus others. And then, as I mentioned earlier, some of the stuff about new standards and things like that that we could integrate in these processes. And the Bureau of Local Projects, we have two different program areas, really. So the City Connecting Link Improvement Program, the easiest way to explain that is like it's when the highway crosses through a city. In our state, that's a local street, but it does have a highway designation on it. And so we have maintenance agreements with those entities. And then the K1, 2, and 3R programs are pavement preservation programs with those local agencies. So really utilizing the safety performance analysis and doing things like desktop crash reviews to help inform discussions with local agencies. Revisiting, they have site visits with those local agencies that would help them to better capture the safety improvements, and then providing them with a list of what would be safety eligible countermeasures so they can look for opportunities for integrating those in those projects. In the Division of Multimodal Transportation Innovation, we're dealing with two bureaus there. So I mentioned the Vulnerable Road User Safety Assessment tool. That was developed with the Vulnerable Road User Safety Assessment, but we've been working with multimodal transportation for 2 years now, actually, that they're utilizing that tool in their TA application process to basically teach people how to fish. So they say, go use this tool, identify a priority corridor, make safety recommendations, and you're going to score better on the competitive process. At that program, that helps us spin to our VRU goals, but it also helps us get stronger safety applications out of this process. In the Safe Routes to School program, there's the planning and programming category, anything that's education or enforcement related. Most of that stuff is also NHTSA eligible. So we're also having some discussion with them about basically they could send those over to us and we could potentially fund it with NHTSA dollars. Last bullet there, under our Drive to Zero plan, we established a high-risk urban roads category. Phase 1 was about stop controlled intersections. Phase 2 is actually about vulnerable road user countermeasures. And what we're focusing on is quick, like materials only program delivery. So not requiring a lot of design work in that process. And really what we're talking about doing is doing high visibility crosswalk improvements under like a quick delivery program method. And then Bureau of Innovative Technologies, we have a state grant program for that. We participate in that scoring process. They already have a pretty strong scoring process that benefits safety. But we're also using that process to say some of this stuff is either like we have some safety dollars that could help fund it. So if they don't get selected through this grant program, we're kind of on standby, or we reach out to them to see if they want to consider some of the other programming options we have. I also want to give them a plug for in our safer vehicle strategies. We have some strategies for connected vehicles and autonomous vehicles, and they've been good partners, and they've got some grant programs that are bringing some of these dollars to different agencies, and then we're using those grant funded projects to evaluate effectiveness and understanding what we should be doing as a state in this area. All right. That's it on safety code benefits for now. On post-crash care 1, this is the assessment of timeliness and quality of care. This is ongoing work, but we did an assessment and we developed a tool to help our partners understand where maybe timeliness is an issue. And so this map quickly shows you the results. It's called a bivariate color map. One is where the response times are low, and then that's the goldish color. And then the blue color is where there is a larger percent of fatals that were not dead when first responders arrived, right? So they died sometime in transport, at the hospital, or within 30 days. There's a lot of different ways we can run this analysis, but this is how we started. And so basically the black and the brown areas on this map are areas that you would say, okay, they look like they're performing poorly in both areas. So they're kind of suspect corridors or counties for us to take a closer look at. Where this relates to other DOT partners. So this is where our Bureau of ITS, which manages the traffic management centers, and the cameras and all of that, that sits within that bureau. Our field operations is basically our district offices that respond to scenes. They close roads when incidents occur, things like that. And then even our Division of Aviation. All of them have been very engaged partners in post-crash care because they're thinking of things like maybe I need maybe I need a camera on that corridor, right? Because we don't know when something happens and it takes an ambulance 30 minutes to get to that location. Field operations thinking about, different technologies that relate to when they're responding to an incident and their role in that. And then our Division of Aviation has been a really interesting partner because it kind of just started with, if you just look at the kind of the basic stuff of like, where do we have air ambulances? Are airports need an improvement for that, right? And so they were looking at their improvement program for airports and saying, well, maybe we could just kind of encourage them. Like, do you need improvements for that type of service? But it's also gone beyond that because they're doing a lot in the space of drones and beyond line of sight and innovations that are happening in the drone space that hold a lot of promise for post-crash care. That's everything from drone as first responder programs to medical equipment and materials delivery and things like that. So it's these are types of partners that historically have not really been involved in the safety discussion. But once you talk about incident response and post-crash care, you start getting people that you haven't historically heard from. Okay, so that kind of just culminates at the very end. That is a sampling of some of the stuff that we're doing. I really tried to focus more on the work that we're doing within our agency, less on the work we're doing with the partners outside our agency. So.
That's really, really great information, Vanessa. I really appreciate the overview. It's really interesting to hear about all the different partnerships that KDOT is sort of engaging with. It seems like partnership is a theme. We heard Mike talk about it in his presentation. There's just a lot of overlapping pieces that we've heard throughout today's presentation, which is why we want to maybe explore things a little further through a panel discussion. We've got four speakers today, 3 of which are with us today. I encourage anybody who has a question to type it into the chat. So far, I haven't seen anything so far. I've seen a lot of good links provided by people who are helping run this webinar. But maybe I'll start us off with just asking a few pointed questions to some of our speakers, and maybe it'll spark some questions from you all in the audience. I'll start with Lauren. Lauren, you talked a lot about your partnership with the public health sector, and I think that's really interesting. It isn't someone I always think about when I think about thinking about safety, but these partnerships can pay dividends in terms of how we message on safety, how we create interest in public safety, and more specifically in how to fund what we do in public safety. And so I was wondering if you or anybody on the panel has seen sort of benefits through these partnerships in terms of advocating in your state legislature or through other means to obtain funding to advance safety goals.
I'll provide a very brief response. On one of the PADS RSAs and it's so interesting that, we go through a data-driven analysis to identify those PSAP corridors that are largely based on roadway characteristics. But when we look at the communities that are living along those corridors, they very commonly are lower income populations. And so there's just this natural linkage with the public health type community. And so when we were in Danville, Virginia, developing a road safety assessment, We went through the process, and the health officials and their partners really appreciated being part of the process. At the end, when we developed out some of the recommendations and naturally got to the part of, who can do what, are there places in this that we need somebody to really strongly advocate and push for certain recommendations? It was actually the public health partners who said, I can do that. So they didn't have a lot of money resources to necessarily bring to the table, but they were very willing to be that push or the nudge within like county resources where they typically sit, so they could really kind of be that voice to advocate for even relatively low cost improvements, because it's easy for a lot of these things to fall off the table and kind of lose visibility. But anyways, that was really striking to me, is that, maybe funding wasn't so much their resource, but they were very willing to be a champion on the long haul.
Great. Anybody else have any insights onto just maybe how you're leveraging these partnerships to advocate for public safety and maybe even additional funding? It sounds like I saw in the chat that Vanessa mentioned that there's a lot of state funding for what she does, and it's a testament probably to all of the things she's been doing. So that could be part of why they've been so successful in Kansas. I don't know if Vanessa, you have anything to add on that end of things?
Yeah, we have several programs. So we have the state generally passes a state-funded transportation program about every 10 years. And this actually predates me. The former secretary really sold this idea of, don't make me just draw lines on maps of projects. Allow me to have some flexibility with some large-scale programs and dollar amounts that we can then quickly deliver. And so I was able to come in one of those first years and just start building out some of these things with others in the agency, right? Of, okay, how would we actually deliver that? So I think it's really important that, this is a performance management group. It's important to show your outcomes and your outputs out of spending that money, right? And so we do so much work, and one of the things that we're probably not great about is like recognizing how much gets accomplished, right? And celebrating it, and every little rumble strip matters. Every little improvement really does add up. We have a strategy that's called prioritizing implementation of local safety plans, right? We've done county local road safety plans. We have 60 something SS4As underway. We've got a lot of efforts underway. And so one of our action steps is quantifying the magnitude of need. So we are actually going through all of those local road safety plans and SS4A plans, all of our engineering studies, and we're saying how much dollar amount is in there. And then it's really to inform the next program, right? Is that there's hundreds of years of needs right now at the funding level that we have. Whether you want us to deliver it or you want the local agencies to deliver it, there is a pent-up need, and these agencies know what they want to do, and they've established some priorities around what they want to do. So we're trying to get ourselves ready for kind of making that next case that needs to be made at the end of this program.
Anybody else want to add to that?
I'll just quickly say, in Kentucky, we have similar programs that we've worked with our legislature to set up, where we don't have any specific project or location identified yet, but we define kind of the parameters of how we'll utilize the money, and we've had some success there. We're hoping to build something around roadway departure in the near future. It's been challenging this particular legislative session. Money woes have been pretty severe in Kentucky this session. So I don't think we're going to get there this year, but that is similar to what Kansas does that we do.
Say we are also dealing with budget shortfalls and things like that, hence the interest in the funding. We're also on the verge of thinking about reauthorization for highway transportation bill. Mike, I might ask you just a follow-up question. You mentioned the design build approach that you took, in addition to some other innovative techniques that you've been building on. Sometimes when you do new things, it can lead to maybe some resistance internally. I'm curious if you and this question is for everyone, but just as you go to, embrace some of these new practices or consider new practices, innovative practices, what have been some of the biggest hurdles to kind of institutionalizing some of those things? What have you done to help bring your partners with you to convince them that it's the right thing to do? Maybe it's simple as just I showed them the data, but I'd be curious if there was something else that you did or you thought was really useful in your journey to sort of adopt these new approaches and practices.
That's interesting because I was hoping I would be able to put this in there somewhere. When we, in a lot of the brainstorming, it occurs within the teams that are already wanting to do things. So there's no sales pitch for those folks. But when we start bringing others that maybe haven't been involved in the process into the fold to say, hey, we're looking to do this, we've changed how we approach that. In the past, it would be more, let's tell them what it is and some of the why, and can we have permission? We don't ask that question anymore. We approach it as we're doing these things and they're leading to these things. Do you have any questions? Because if they don't like it, they'll tell you no, right? They'll, hey,
Yeah.
no, we're not doing that. But if you present them with, can we do it? Or what do you think? Like, well, then you're putting them in the hot seat and people get uncomfortable. And it's, well, let me think about it and get back to you. And then they're busy and they never get back to you and you got to nag them. And so we've just changed the narrative. Just instead of asking a question, it's just, hey, we're doing this. Here's why. Here's what it is. Thanks for meeting with us. And if
Mhm.
they're not comfortable, they'll tell you no. But
Yeah.
it just changes that whole dynamic. And so we've had way more success when we've just pretended that, look, everybody's on board, let's do it. So
Yeah.
I would encourage folks to take that approach, especially if they typically get told no a lot. Stop asking.
Yeah. Yeah. You all are all involved in these advanced initiatives, Kansas, Virginia, Kentucky. What you guys do and how you do it and the success that you're achieving isn't created overnight. It's something that's built. And I'm curious if there's any insights as to the journey, the sort of the foundational aspects. I mean, Vanessa, you mentioned a previous director, somehow creating this funding through the state legislature that led to what you do. But it's a journey, and it just does. It's not a light switch. There's not like on off. It's something that happens over time. I'm curious as people who've been in your position for a little while have worked with people in your respective organizations. What are those foundational aspects that have led to where you're at now?
It's going to sound very token, but I think culture is like the underscore of it. And it's that statement of like celebrating others is really important. So there's times where whether it's through, we just send these different like K.all communications agency wide that give an update on something that's happening, or we have these internal agency newsletters called Translines. We work with our communications division to say, let's tell this story, right? And it's not our story. It's like maybe it's this other group doing this thing, right? So then it doesn't become that only Bureau of Transportation Safety delivers transportation safety, right? It becomes like everybody's doing it. We've also had, I mean, our bureau has grown a lot in these, ever since IIJA and our new program that has a bunch of safety programs. We had to scale, but we've also had turnover. And what
Mhm.
is kind of great is that we're never short of applicants, right? Like people understand the work that's being done and they want to be part of it. But they also know that like they can bring something else to it, right? A different angle to it than um what we were considering before. And I think the biggest thing is that when you're, leading in this space, you have to understand that like go where you think you can build momentum, right? And there's times where you can't build momentum. It's not the right time. Slow it down. Focus elsewhere. There's plenty of work to do.
Yep.
Um,
I'll jump in here. I think the culture statement is a big one. And rooted in that is getting people to trust you. So to get somebody to trust you, though, they've got to get to know you. So you got to make intentional effort to get to know your partners. Not only when you need something from them. You got to take some time to get to know them. The other thing too is just of the people that you manage, how do you change how they approach things? So like when I took over the traffic safety branch, we took a hard look at our internal mission statement. We didn't have one before, but it's like, all right, we're making one and let's take a hard look at it. And we deliberately started our mission statement with to help people. And then there's a bunch more, but it starts with to help people. And I remind our project teams of that all the time, like especially when we run into something challenging. Well, we can't do this, we can't do that. There's this, there's that. I was like, okay, I understand, but how are we going to help the people that are having problems? Like that's our mission is helping people. How are we going to do that? And getting everybody to start thinking that way. And then it starts to naturally, well, how can I help that division, or how can this division help that one and this office? And it just changes that dynamic when you can get that culture of like, hey, we're here to help others, whether it's our teammates or the citizens or whomever. And so, but a lot of that starts with getting to know people, building trust, and then changing that culture.
It's great. Kelly or Lauren, I don't want to leave you out of this. I'm watching the little mute symbols in case you have something to add. I don't want to overlook you. If you have something to add, please jump in and I'm going off of what I heard and what I found interesting in some of these things. I don't know, Lauren, was there something you wanted to add to the conversation?
I'll just add one thing. If y'all remember the beautiful road map graphic in the slide deck that showed you saw a lot of milestones in that journey, and I think one thing that I think we learned is it was an iterative process. The development of a risk-based network screening 5 rounds every time you want to tinker with it. And one thing I didn't get into is when we first learned about the HOI data set from the health department, we ran statistical models to learn more about how relevant that was to pedestrian crashes, and it was extremely relevant. So we're like, oh, this is not just a neat feeling idea, but it's a relevant data source. So every time we learned about a new data set, folded it in, ran some models just to test the efficacy of it, and I think it just continued to build the strength of the programs and the interconnectedness even more.
Yeah, that's actually kind of a question. You're talking about some stuff that I save for the end because it's more of a Ryan question than and maybe it'll expose some of my ignorance as to what's going on in the safety sector of our business. But we heard Jeremy talk about telematics. Telematics is something that a lot of vendors bring to us, and there's just a lot of different tools out there. There's a lot of different data sets out there, all of which are being sold to you by vendors as like, this is the silver bullet. This is going to solve all your problems. If not, it's going to transform your decision making. And, I talk to some of my colleagues and peers, and it isn't all always what it's cracked up to be. But, Ohio seems to have found some success in its use. Beyond telematics and other big data, what other aspects of technology and innovative practices are you guys applying to, improve your performance? I mean, the elephant in the room, artificial intelligence, is it being leveraged in some way, shape, or form? What are you guys using? Data science, Lauren, you just mentioned statistical methods. I'm just curious if are the things you're dabbling in, your teams are looking at, are they, I'm just very curious.
It's a big question. Yes on telematics, yes on, when people are talking about doing risk assessments, like typically what you're doing is you're doing GIS analysis with a lot of contextual factors to say, is this overrepresented, right? You're doing this comparative statistical sampling of like 13 times more likely to occur at this location, right? And so there's a lot of kind of analyses that goes into understanding like what is a risk factor in these different environments. So I think yes on that. I would say on the AI front, our crash data as a state is not yet to a point where we could like feed it to an AI with any level of accuracy. Like it's just not strong yet. We're working towards that. We've got some efforts underway. Where I think AI features, I don't know what you would call it, is more applicable is things like image recognition, right? So like we use LiDAR data to tell us where different type of inventory features exist, because then we know what type of intersection control that is, what type of approaches it has, right? Like we can then quickly understand a statewide network and understand by type, how much volume, what's the approach, what type of sign-in features are there. Like we are able to use LiDAR image recognition to basically help us understand where assets exist and where they don't exist. And then compare that against our safety analysis or use that data to inform our safety performance analysis. So that's for me on the AI front. That's more of what we do. We use on the telematics front, we have, I won't do a sales pitch for our vendor. We use a vendor that has more than just telematics data. And that was important for us because we wanted a solution that could bring a lot of different things together. So they had telematics, but they also had a bunch of other things for us, like land use and volume and speeds and point of sale data, things that had a larger use case for us.
So I'm going to talk about, we've got this vision of zero, right? And when you think about as we achieve that, the current piece of data that's at the heart of a lot of safety analysis is crash data, especially the severe crashes. But as we get closer and closer to zero, we're going to have less and less of that core data. That's because crash data is a lagging indicator. So to me, what you're really talking about, Ryan, is how are we identifying leading indicators? What are pieces of data we can collect and measure and monitor that tells us the risk, as Vanessa was talking about, for our severe crashes? And so a lot of the telematics data, other pieces, like we're starting to collect continuous friction data. Well, I shouldn't say starting, we've been doing it for 6 years, but it's pretty logical. Friction's an important part of, can I safely stop or make a maneuver? But near miss data, it can be a leading indicator. If you start, especially if you have a site that hasn't necessarily had a lot of near miss and then it starts creeping up, like that could be an indicator that something's changed or something different's happening. Some of this is we don't know what those leading indicators are yet, but like we need to be finding them now while we have the ability to make pretty strong correlations or find those overrepresentations. Because as we get closer to zero, and I'm drink the Kool-Aid, I'm full-fledged, we're going to get there. It's going to be incredibly hard. And it's one of those to where if we don't figure out what the right leading indicators are for this community or this state or whatever agency jurisdiction, like we're going to get close and then we're going to get stuck. So we've got to start thinking about new and different ways of figuring out what our challenges are and what the opportunities are. And so just a key takeaway for me, if I was in the audience, is, I need to start looking at what's a leading indicator. Is that something I can either measure myself, or is there a vendor out there that can help me get that data? And then start digging in.
And I'd like to add to that with what Michael's saying. It's not even when we get closer to zero. It's for states that have lesser crash data because we have a smaller population base, but have huge land area. So our fatalities are pretty random. We don't have a lot of areas that you see more than 1 or 2 fatalities. And so how do we prevent those from happening because we don't have the crash data to look for those areas? So using roadway characteristics and looking at telematics data will go a long way to help us figure out what's the real reason behind those fatal and serious injury crashes, we know part of it is behavior, of course, but there are other things that lead to it, and that other data helps us get there.
That's great. Oh, go ahead, Vanessa. Sorry.
Yeah, the other thing too that, if this is a performance management committee, right? So the work that we're doing, right, then the safety co-benefit work, it's like, okay, how do I help to sweeten the pot, right, in all these different areas? If we really want a whole of a DOT approach, then at the very face of it, if in the STIP a program says it has safety benefit, the question is, how are we measuring it? If you're not measuring it, then you don't know that you're actually meeting your program objectives. So, I would say like a performance management, like perfect world is that all of those program areas that say that they do safety benefit, what does that look like? How do we measure it? Is actually affecting crash outcomes, right? But right now, most states were not operating that way. We're operating as HSIP offices that try and help where we can, right? And so I think that's where, performance management folks can really help out, right? Of if all these groups want to help towards this cause, let's talk about what that actually looks like.
That's great. And it looks like we're running up against the end of the hour. I maybe the pitch, the landing the plane pitch is, September 28th through the 30th, 2026. Safety Summit is happening in Hartford, Connecticut. That'll be where I'm sure, much more can be shared on safety and performance, and maybe even more on technology and how it's being leveraged to solve our safety problems. And so with that, I'll turn it back over to Jean to take us into the end of the webinar.
Well, thank you so much, Ryan, and thanks to all of our presenters. Amazing expertise, and appreciate all of your time and your engagement today, and for the great discussion. I kind of wish this panel could go on another hour. It's fantastic. I also want to say thanks to you, Ryan, for facilitating today's panel presentations and discussion. I really encourage all of you to stay engaged with us, to continue engaging with us, and to learn more about the Committee on Performance-Based Management, to access the series archives, and to explore performance management resources. And you can do all that by visiting the TPM portal at tpm-portal.com. Our next webinar will be on June 17th, examining the use of access as a performance metric. And we look forward to seeing you there and at upcoming subcommittee meeting, and hopefully in San Diego as well. So with that, we'll close out the day. Maybe a final thank you to our support at Vaughn Partners, and of course to Ashton. Thank you so much, everybody. Have a great day.